Okay, it looks like we have quite a few people who have joined. So why don't we go ahead and kick things off? So greetings, everyone, and happy Earth Day. And many thanks for joining us today. It is my great pleasure to officially kick off the Transitioning to Clean Cooking webinar series, which has been developed by the Clean Cooking Alliance and the World Health Organization as part of the Health and Energy Platform of Action, which you'll hear more about in just a minute. This session is the first in a series of webinars. Can you go back one slide? That we will be hosting this year that aim to provide those working to advance clean cooking with the latest technical guidance, tools, and resources needed to undertake effective policy and funding decisions that will accelerate progress on clean cooking. So today is our first session where we'll be focusing on sharing the latest tools available to support national needs assessments and stakeholder mappings. Next slide. So for those who don't know me, my name is Julie Ipe. I'm a senior director at the Clean Cooking Alliance, where I co-lead our market strengthening efforts. And I'm very pleased to be your moderator for today. We have a fabulous lineup of speakers and a really packed agenda. So we'll start with some introductory remarks and an overview of HEPA, including the High Level Coalition, which is a really important initiative of HEPA. And then we'll have an overview of the very cleverly named tool that we'll be reviewing, which is the HEART tool. And then we'll hear from some practitioners and policymakers on how this tool has been used in practice and some of the lessons that have been learned to date. And then we'll open it up for Q&A and discussion for the last 30 minutes or so. So just a few of the usual housekeeping items before we begin. Please use the Q&A function for any questions you have for the speakers. And we'll try to get to as many of those as possible when we get to the Q&A session. We will be recording the webinar, so that will be available after today. And then we'll also make the slides available on the webpage that we've developed for the webinar series, which is where you can also find information about upcoming webinars. So with that, I think we should go ahead and get started with our first speakers. So I'll now invite Dymphna van der Lans, who is the CEO of the Clean Cooking Alliance, to provide us with some introductory remarks. Over to you, Dymphna.
Thanks, Julie. Welcome to everybody, and echoing Julie's comments about how exciting it is to be part of the launch of this webinar series. Huge thanks to our wonderful partners at WHO and HEPA to work together with the Clean Cooking Alliance to create this, what we hope is a really impactful series of webinars. It's an exciting day. It's Earth Day. President Biden just 30 minutes ago kicked off the US Summit on Climate, where he's invited 40 leaders to join him to really focus on concrete actions. And it's an important year. We have the high level dialogue on energy, we have COP, so we're really excited to make sure that we continue to bring different stakeholders together in the clean cooking ecosystem, which is specifically relevant for today's meeting. We so often say how important it is to make sure that people who are focused on health and people who are focused on energy and clean cooking specifically work together and come together. And it's easy to say, but it takes a lot more work to actually do it. And so for me personally, what's really exciting about today is this is actually concrete action towards bringing people together. And so I'm really looking forward to hearing more about this specific tool, because we all know that there is not one single solution to address this issue. And so we need various tools, but we need to make sure that those tools are used by policymakers so that they can make well-informed decisions to create impactful policies at the national level. And so we really welcome all of your feedback. Share with us your thoughts about today's event and how we can make it sharper and more applicable for the work that all of you are doing. And so really looking forward to today and very exciting for the launch of a complete series of other webinars that will be coming in the coming months. So I'll hand it over to you, Julie, or to Maria directly.
Julie, you want me to start? Julie, we can hear you.
Oh, I'm so sorry, I was muted. Yes, I was just introducing you. Yes, please, Dr. Maria Neira, who's the director of the Department of Environment, Climate Change and Health at the WHO. Over to you.
Thank you, Julie. Thank you, Dymphna, and thanks all the participants for being here. It's really a pleasure to be on partnership with you, and particularly today, which is such a symbolic day. It's amazing. We are celebrating the Earth Day, so happy Earth Day to all. We are in the middle of just starting this exciting climate summit that can change completely the way that the big countries are committing to climate targets. And at the same time, we are, of course, trying more and more to recover after this COVID-19 and hopefully starting to see something very positive and light at the end of the tunnel. So it's a perfect time for being very positive, proactive, constructive, and offering solutions. I agree with you, Dymphna. It's about being very concrete, very pragmatic, and action-oriented. So happy to join all of that. You know, we need to make sure that we provide the recommendations for these people who are at the moment struggling and still not having access to clean fuels at the household level. I know that the figures are presented so many times, but I think we need to repeat some of them. And one of them, the ones that needs to give us all the passion and enthusiasm to do more, is the fact that still we have 2.8 billion people without access to clean fuels at the household level. And the worst of that is that this figure didn't change for the last 2 decades. Imagine all the efforts and then maybe all the evidence that we have been putting on the table saying that these represent death for 4 million people every year in the world, 4 million premature deaths every year due to the fact that you are not privileged enough or you are not lucky enough to have access to clean fuels. So we need to change that. We need to change it. And I think what we are presenting in this webinar are exactly that, how to change that, how to scale that, how to be more ambitious, how to multiply by 100 the efforts that have been done. We need to make sure that any politician or any government will not be able to say, oh, I didn't know how to do it. I know that it was a problem, but I didn't know what to do about it. Now we have plenty of tools, solutions, interventions, ideas, evidence, partnership, and of course, even we need more financial resources, but everything is there. So no excuses, no politician using that sentence, I didn't know. So it depends very much on us. And us means as well as WHO, the health professionals, we still need to do a lot of work with them, making sure that they understand that this is about health. It's not just an environmental issue or an issue for those working on ecosystems or working on energy aspects. This is so much about health. And that is why this HEPA, and allow me, I hate acronyms, so allow me to say what HEPA means. Health and Energy Platform for Action. Isn't it beautiful? So this is exactly what we want to do. And so I'm so happy to see so many people connecting and interested on this topic. And I really hope that the health professionals will feel extremely engaged because this is very much about health. This is about transitioning. And of course, this is the word we all need after this horrible crisis in the pandemic, transitioning to something much better, and transitioning to clean energy at the household level is definitely a fantastic mission. So let's go for that. And thank you all, and happy Earth Day to all. And thanks for this opportunity. Over to you, Julie.
Thank you so much, Maria. Those were very powerful words. I would now like to invite Sheila Oparaocha, who is the International Coordinator and Program Manager for ENERGIA, and who's also been very actively engaged in HEPA, to tell us more about the high-level coalition of HEPA. Sheila, over to you.
Thank you very much, Julie, and it's always a privilege to speak after what I consider two great role models for myself, Dymphna and Maria, and who have been instrumental in in us making progress on the clean cooking agenda. I'm happy to be speaking to you today as a member of the Health and Energy Platform for Action, which energy has been a part of the journey, and we've been part of the journey because of the objectives of, we strongly believe in the objectives of HEPA, which are to strengthen the political and technical cooperation between the health and energy sectors to accelerate the transition to clean cooking. So really looking at interlinkages between two very important sectors to deal with this issue. And the initial focus is, of course, on clean cooking for the very pertinent reasons that, that Maria has mentioned, but also on electrification of healthcare facilities. I wanted to share with you some additional information about what we're doing, and Maria, forgive me, but I am going to use the acronym HEPA, which is about the mission of the High-Level Coalition on Health and Energy. Now, the High-Level Coalition on Health and Energy is convened by the WHO Director General, and it was established to demonstrate the global leadership in advocacy and action required to create the political momentum, drive practical solutions, spur investments, and mobilize public support and multi-stakeholder engagement for clean cooking and sustainable energy services in health facilities. The coalition consists of high-level representatives from the UN, recognized countries, with established or envisioned corporations with the Ministries of Health and Ministries of Energy, and also with health of selected organizations and institutions that act as champions. I'm very honored and pleased to be a member of the coalition, and I particularly look forward to driving not just the health and energy agenda, but also bringing in very much the persistent gender challenges that we have in access to clean cooking. So bringing attention to that and bringing political attention to that, and putting women at the center of HEPA and the coalition and the clean cooking, universal access to clean cooking, making sure that we have equal and equitable access to clean cooking and control over energy services for all. Just to move on with a bit more information about the coalition, the focus is going to be very much on translating political ambitions into much needed policy and practical change. If we look at most of our countries, we see that we're making very little, though we have made some, we do have trailblazers, and we have made some advances, but on the policy and the enabling environment, we still have a lot to do. 5 key roles are envisioned for the health and energy for the coalition. And these are: 1, to encourage political support as necessary to make sure that access to energy in health care facilities and clean cooking are priorities; to provide strategic leadership in achieving the objectives of the Global Health and Energy Platform for Action; to help raise awareness about the health energy agenda and needs, including during high-level consultations and global and regional events, such as the UN Secretary General's high-level dialogue on energy. So this year is going to be a very important milestone for engaging with the coalition. But other than that, we also have the high-level political forum that's coming before the dialogue. That's going to be important. And of course, let's not forget the Conference of Parties of Climate Change, COP26, that's coming, the World Economic Forum, and the Africa Parliamentarian Summit. So these are a few milestones that the coalition can be used to leverage that political commitment and momentum that we need to address this problem. The coalition has also been established to mobilize the much needed financial resources, including from governments, multilateral financial institutions for the private sector, but also to serve as global champions on clean cooking and electrification of health facilities, and to help us tackle these issues. The coalition will, of course, work in very close cooperation with the Secretariat of HEPA, which is WHO, but also with all other convening organizations of HEPA. The first meeting of the coalition, I'm very pleased to announce, is going to take place on the 9th of June. And I'll even give you the time and date, the timing of it. And that's going to be from 14 to 15:30 Central European time And so we look forward to all members joining. And this, we hope, is going to provide an opportunity, first of all, to exchange high-level insights on the challenges and opportunities to accelerate access to clean cooking and electrifying health care facilities, but also identify concrete activities aimed at increasing awareness. What are we going to be saying at the, and what actions are we going to be proposing? What ambitions and commitments are we going to be trying to drive at the high level dialogue on energy? So to raise that awareness, to spur investments, to mobilize support through joint strategic roadmaps to promote healthier populations through clean and sustainable energy. And also, of course, most importantly, to explore avenues for increased cooperation between the health and energy sectors, but most definitely between other sectors, for instance, the gender sector, as well as the climate change. So with these few words, I would just like to say thank you and hand over to you, Julie.
Wonderful. Thank you so much, Sheila. And many thanks again to all of our introductory speakers. I think we heard some common themes there about how important collaboration is, especially between the health and energy sector, but with other sectors as well. And also just this referring theme that we hear often in clean cooking, that there's just so much work still to be done and action that needs to be taken. So with that, I would like to move on to the tool that we'll be discussing today, which we hope will help to drive some of this action and really help folks to sort of be better poised and equipped to design policies and programs around clean cooking so that we can accelerate progress. So I will now turn things over to Jessica Lewis, who's a technical officer at WHO, who will tell us all about the HEART tool. Over to you, Jessica.
Thank you so much. Very nice to be with you all today in the launch of our new series. So today I'm going to provide an overview about the HEART, the Household Energy Assessment Rapid tool that can be used for situational assessment and stakeholder mapping. And I'll first provide just a little brief context around household air pollution and its health impacts, and then an overview of CHEST, which is our toolkit for household energy tools and resources, and then move into details about the HEART templates. So first, to provide an overview for those that may be a little bit newer to this space, we are speaking about household air pollution, which is a mixture of pollutants that are released during the incomplete combustion of carbon-based fuels in and around the home. So we've transitioned from calling it indoor air pollution to household air pollution, since sometimes the pollution arises from nearby in the home environment. And household air pollution is released during the combustion for activities such as cooking, heating, and lighting, when very small particles, like those less than 2.5 micrometers, penetrate very deep into the lungs, where they can affect the body, contribute to many diseases. And the effect of household air pollution is substantial because there are still more than around 3 billion people that primarily cook with polluting energy sources. So here you can see that although as a proportion of the global population, the proportion using polluting fuels and technologies has decreased, it has remained basically constant as a total number of people for the past 20 or so years. And the result of this is a really unacceptable health toll. Around 4 million people die prematurely attributed to household air pollution exposure. And these are mainly from cardiovascular and respiratory diseases. But in addition to those very substantial disease burdens and risks, there are also injuries that come from using polluting fuels in a inefficient stove or cooking system, as well as burns or poisonings from different fuels. And there are non-health burdens that are also very important to consider, such as those from the time use that is spent gathering fuels or cooking in an inefficient system, as well as environmental risks like degradation and climate impacts. In response to these very significant health impacts, WHO produced the first set of guidelines for indoor air quality focused on household fuel combustion. And the recommendations in the guidelines call for fuels and technologies to meet certain emission rate targets for PM and CO, which are used to then determine whether that fuel and technology combination can be considered clean for health. The guidelines also call for a policy during a transition to clean fuels in contexts where this transition will take time, that the transitional options should be as clean as possible. And the guidelines call to avoid specific fuels based on the certain inherent risks from using these fuels, which are unprocessed coal and kerosene that should not be used in the home and are discouraged for kerosene from use in the home. And finally, the guidelines call for policies to incorporate synergies between climate, health, and clean energy. So we use these guidelines to determine and define what fuels and technologies are clean for health at the point of use. So I'm providing this background before we then talk about these tools that can be used to promote these clean fuels and technologies in the home. So WHO currently defines clean fuels and technologies at the point of use as biogas, LPG, electricity, alcohol-based fuels like ethanol or solar, and polluting fuels for household energy in the home as open fires, kerosene, candles, or unprocessed coal. Biomass, stoves, and fuels can be considered clean. The key question here is whether or not the fuel and technology combination achieves the WHO guideline levels. And this links to the ISO voluntary performance targets as well. So we use this information and we developed, WHO is developing, you can go to the next slide, please, the Clean Household Energy Solutions Toolkit as a tool for implementing the guidelines to help countries develop strategies and programs to expand clean household energy use. CHEST contains a set of resources and tools. And if you'll go back for a second, please, the tools that we'll be discussing today are from the first CHEST module, which focuses on situational analysis and stakeholder mapping. There are many other tools available on our website, and they help countries on different steps of this process, for example, on standards or monitoring and evaluation, or different tools for assessing different policy and technological options. So moving on to the tool that we're focusing on today, which is the HEART templates. In brief, I'll start with an overview. The Household Energy Assessment Rapid Tool, or HEART templates, are two different technical templates that are designed to be completed by specialists in the fields of energy or environmental health. And so we currently have one template that is designed for completion by the energy specialist or team, and a second that would be intended for completion by the environmental health specialist or team. And these templates are downloadable from our website, and we'll put the link in the chat here for you to be able to access, as well as a final report template that is used to guide in the creation of a final report that compiles the information collected from these two templates. We also have and are in the process of finalizing these tools in different languages, including Spanish and French. And if you're interested in receiving those tools, then we invite you to email us at this address. And again, the slides will be available after the presentation. So now to dig a little deeper, what can you do with these tools? They are designed to help accomplish two objectives. So the first objective is to conduct a rapid situational assessment of current household energy use in a country, or it could be in a smaller context within the country. And we focus in the templates on cooking, heating, and lighting, which are three of the major sources of household air pollution and negative health impacts in the home. So the templates contain detailed questions and guides for information that should be collected to assess the extent of household air pollution, as well as its health, safety, and livelihood impacts, the different fuels and technologies that are used in the home, existing standards, regulations, or policies governing fuel distribution, use, as well as existing price or subsidy structures, plans or programs that the government may have in place to address household energy use, and finally, any plans or barriers problems or barriers for the expansion of, that is plans or barriers for expansion of clean fuels or technologies. So the goal of the rapid situational assessment is that this detailed knowledge would inform and enable future household energy programs and planning. The second main objective of the HEART templates, on the next slide, please, is to conduct a mapping of the existing stakeholders in this space. So those working on household energy, air pollution, health, or related sectors. And so the stakeholders may come from ministries, institutions, organizations, programs, individuals, and the templates provide a set of questions and guides for the questions that should be considered by the consultant or individuals that are conducting this review and doing the stakeholder mapping, and also call for focusing on the scope of work and responsibilities, links between the different stakeholders, as well as to identify any existing coordination mechanisms. So by completing this stakeholder mapping, the goal is that it will assist with identifying any windows of opportunity or potential partners for future involvement, or the opportunity to develop a recommendation about how to enhance or expand coordination mechanisms based on a better understanding of what's currently in place. So how can one use these tools to conduct this situational map assessment and stakeholder mapping? As I mentioned, the tool consists of a set of questions and prompts, which are designed to promote a combination of key informant interviews. So the templates recommend which sections should be addressed by an interview, such as with relevant government ministries or international organizations, universities, and others, or which sections of the template would best be captured via desk research, such as by looking for local studies that have been conducted on air pollution and health, or providing links to existing resources like WHO databases. And they are designed to be completed currently by an environmental health specialist as well as an energy specialist. This is an overview from the Ghana report that was produced following these templates. And so as you can see here in the contents, the goal, using the templates, the report is able to summarize the country context, the health impacts, the current situation for household energy use for cooking, heating, and lighting, the involved stakeholders, existing social interventions, which might provide an opportunity for connection where household energy programs could be integrated, as well as an extensive discussion section, and finally, some conclusions and recommendations. We are very pleased that 4 of these reports are completed and are available for download on the site following the link that was put in the chat. And those reports were done by WHO, working through headquarters, our regional offices, and great support from our country offices. And there are several other reports which are near final and in the design phase, which are listed here. Many of these have been done through WHO, again, with support from our regional and country colleagues. There have also been a few that are being led by the CCAC, and we have a few more, including Togo, which I neglected to mention here, which are earlier in the process, but are underway. And I now wanted to share some of our plans for improving the templates. So as I mentioned, they are available for download, and we have had some very good experiences working in countries using these templates to obtain this snapshot of the household energy situation, as well as a mapping of the stakeholders. But we are now taking this opportunity to update them based on the experience of countries implementing them and feedback we have been receiving. And we're in the process of merging these templates that are currently a separate template for an environmental health specialist and a separate one for an energy specialist, as well as a report template, all into one comprehensive template that provides an outline incorporating all the environmental health and energy information, as well as the main report headings. So it would be an easier to use document. And we anticipate launching this in June or July of this year, as well as then completing translations in languages following that. We welcome any feedback you have based on if you have had an opportunity to use the templates, or if in hearing the presentation you have any suggestions, we would welcome your feedback. So please feel free to reach out, and we'll put this email address in the chat as well. So thank you so much. And we hope that this tool will be useful for many more countries, but I now look forward to hearing from our colleagues who can share some of their experiences with implementing the tools. Thanks again.
Great, thank you so much, Jess, and congrats to you and your team in developing such robust tools. They seem very helpful. And so I'd now like to invite some users of the tool to tell us more about their experiences and some of the lessons that they've learned so far using the heart templates. So let's move over to Juan Jose Castillo and Karen Troncoso. We go to the next slide. Oh, great. So yes, next we'll hear from Juan Jose Castillo, who is the Air Quality and Health Regional Advisor for WHO's PAHO. And he'll be co-presenting with Karen Troncoso, who is a research associate for MEX. And they will be telling us more about how these templates have been used in Latin America. So over to you, Juan and Karen.
Thank you so much for this invitation, and for us it's such an honor to share the work that is being in Latin America by the Pan American Health Organization in terms of supporting access to clean household energy. Particularly for me, it's great to have the opportunity to share this presentation with to do this presentation jointly with Dr. Karen Troncoso, that has been a fundamental and pivotal support for this work. Can we go to the next slide, please? So household air pollution is also a common challenge health for the Americas. We want to highlight this and to put some information here showing us that this is an issue also for our region, especially for the Latin American and the Caribbean. So we have more than 90 million of Latin Americans relying on polluting fuels for cooking and heating. When we see the map on the right, we can see that almost most of our countries, in almost most of our countries, at least 5% of the population is relying on polluting fuels for cooking and heating. And if we see this also from an equity perspective, it's even the situation is also more critical, because mostly this extended use of solid fuels and biomass is happening in rural areas and in poor urban areas. So we have like very localized impacts of this situation. Saying that, we also have use of solid fuels for heating in some of the big cities like Santiago de Chile, that is a very well-developed country. 83,000 deaths are linked to polluting for fuels for cooking and heating. So this is an issue for our region, and it's also contributing to ambient air pollution episodes in urban areas. So when we approach to the issue of household air pollution, we are trying to address an issue that is affecting health equity, that is affecting ambient air pollution, and that is creating also a huge burden of disease, but also a burden to promote economic development in the region, because we see that around 2 to 4% of GDP, or the gross domestic product in the region, in developing countries, is affected. The externalities are causing that, are putting that burden on our region. Can we go to the next slide, please? So we definitely in the region are able to see that there is an issue with access to clean energy, and that there are health implications of that. So the Pan American Health Organization has framed its work on household clean energy under the umbrella of the Pan American Health Organization Disease Elimination Initiative. This is an initiative that focuses on communicable disease and addressing communicable disease and environmental determinants of health. And the access to clean energy is considered one of these environmental determinants of health. Actually, in 14 of the 35 countries in the region, 10% of more of the population is still using polluting cookings for fuels. So what are the goals of this elimination initiative? We want that by 2030, 95% of the region, of the population in the region, can rely on clean technologies and fuels for cooking. That by 2050, 98% of the region can have access to clean energy. And that, of course, is also articulated with progress on SDG indicators, those who are related with both household and ambient air pollution. So this is the framework for our work. And in that framework, the hard reports play a pivotal role. We have, of course, different tools. We have the hard reports that we are going to explain more detail in the next slide. But we also have household air pollution country profile that help us to identify in a very summarized way what the country is doing and how can we track progress. And we have other resources that as the window of knowledge where we are mapping all the regional initiatives that are happening in our countries or the initiatives that are happening in our region. What are the policies? What is the state of evidence that is being implemented in the region? And finally, we are also preparing a matrix of evidence of policies and intervention to reduce household air pollution. We are doing a global search identifying what is being done in the world and what are the effectiveness of policies, so we can identify what could be implemented in the region. And we believe that the Americas offer us like a laboratory for what can be done. We have like a very diverse population with different income levels and different settings that allow us to identify, like to test different solutions, and we are proud of the progress that has been made in the region. Can we go to the next slide? So, as mentioned before, the HALT reports are a very fundamental tool for our work in the elimination initiative. And for us, actually, is the core tool to advance in the elimination initiative in the region. As was explained by Jessica before, we have developed 5 HALT reports in the region, in Mexico, Honduras, Panama, Peru, and Paraguay. Those reports are currently under publication process, and it has been a joint effort between the Ministry of Health, the Ministry of Environment, and the Ministries of Energy, and key stakeholders from the academy and civil society. Our focus in this work is access to clean energy and reduction of the exposure to pollutants. And we use those HALT reports to later prepare a specific country work plans that are incorporated into the cooperation agenda that we have with the countries. As part of the challenges and opportunities, I'm probably going to leave this part of challenges and opportunities for Karin Troncoso that I said that is also included in our slides. But just to mention that there is still a work ahead of us. We want to strengthen the participation of the health sector on these processes, and we believe that this is as Dr. Maria Neira was mentioning, this is a health issue that is involved different stakeholders, and the tool and the HALT report, the HALT tool is allowing us to move forward on that. So saying that, I'm going to pass the word to Karin. Thank you, Karin, for being here.
Thank you, Juan. Can you put the next slide, please? Thank you very much for the invitation for the SCCA and WHO. I have the privilege of participating in the developing this HALT toolkit and the implementation of the HALT toolkit in the first 4 countries working for WHO. And it was really a very interesting experience. And because I was working for the Pan American Health Organization, we decided to use it in 5 different countries in the Americas. And we decided to take a different approach, because before what WHO had done was to hire consultants that will help to fill the different templates of the toolkits. And they will find the information through different interviews to different stakeholders, and they will look into the information that was available online to use the toolkit and to make the reports. But what we did in the Americas was a little bit different. What we did is to approach the different government agencies, the ministries, the Ministry of Health, the Ministry of Environment, and the Ministry of Energy in every one of the countries that we work with the HEART toolkit. Then it was really very interesting, this approach, because what we asked of those ministries was for them to decide who will be the focus point on the ministry, and then work with that focus point on filling the templates. And then that person will, on turn, will conduct the interviews and will present all the information from the different parts of the ministry, or the data that they could collect, and then present the information to the other ministries. And then together, the three ministries will look at the information and then produce some recommendation and a roadmap. Then it was very interesting because something very, very particular is that in each country, the leadership was taken by a different ministry. Like, for example, in Paraguay, it was the Ministry of Health. In Panama, the Ministry of Energy. In Peru, the Ministry of Energy too. In Honduras, the Ministry of Health, and in Mexico, the Ministry of Environment. Then we produced these 5 HEART reports. The next one, please. As it was already mentioned, the HEART toolkit gathers information about different parts of the reality of a given country, like information related with the population, with the macroeconomic indicators, with health, with energy, with what fuels are used, not just for cooking, but for lighting and for heating, and the time spent collecting, buying of fuels, and how much, and not just how much, but as a proportion of the budget of the families. And of course, about different cooking practices. But not just that, but another very important part is the policies, the environment in every given country, and what is being done and what can be, how can we decide what windows of opportunity we can see in a given country to continue our work and to increase access to energy, and particularly to clean energy for cooking. The next one, please. Then what we did is to produce these reports for every one of these countries. And just as an example, I am presenting these maps where we will look, try to put in a map exactly where is people cooking with biomass, and then to be able really to localize those populations in a map, and to try to target the policies or the different solutions that we are going to try to implement in different countries. Then something I want to highlight is the HEART toolkit. What it's trying to do is really to do a very good diagnosis of the situation, and trying to look at the situation from the health perspective, from the energy perspective, and from the environmental perspectives. Then what we did with this HEART toolkit in those 5 different countries was to develop a a roadmap with highlighting the opportunities that we can see on those countries. Just as an example, for Honduras, we consider that the importance will be to target the promotion of improved cookstoves only to rural areas, because the government at the moment was having a very huge program promoting improved cookstoves. Then we said, well, it's okay to promote these improved cookstoves, but for the rural areas. But for the urban areas, we think that we are in a good place to promote LPG or electricity. And then we develop a series of recommendations to do that in Honduras. For Mexico, we consider that the most important part will be to focalize in continue the intersectoral work, and in particular with the help of the health sector, because the health sector is very well situated to, for example, to help with the promotion of the different campaigns and to help with the awareness of population in rural areas. And for the environmental sector, something that was really very important was the reduction of black carbon, because Mexico has a voluntary compromise of reducing the black carbon emissions by 50%. And then we could see that one of the routes towards that possibility will be reducing the use of biomass at the household level. For Panama, we were thinking of reviewing the subsidy to LPG to better target it to the indigenous population and the extreme poverty population, because it was very clear that that subsidy wasn't reaching those populations. For Paraguay, we found that a good opportunity will be that Paraguay is about to get full control of their production of electricity, and then it's going to have a super habit of electricity. Then that would be a very good opportunity to promote electricity for cooking. And for in Peru, what we could see from the diagnosis was that the FICE was very successful in allowing people cooking with LPG, but not to transition everybody to use the LPG for everything. It was a lot of stacking, and then we could see that one way of reducing the stacking will be to increase the amount of the subsidy and to allow people to use more frequently the LPG, as is happening, for example, in Bolivia. Next one, please. Then I can say, by using this toolkit now in 9 countries, almost 10 countries, I can see that the challenges of using this toolkit are sometimes is complicated to identify who will be the champion in each country, who is going to take this and go ahead with these ideas, like it's going to take it as their own and continue the work that we are going to start. Something that is complicated sometimes is to get the data that we are trying to collect, and that's very different in every country. Some countries have a very good data and collection, and you can get very, very good, accurate information, and some others are more difficult and more challenging. The continuity is another challenge, because people, especially in governments, people change a lot. And we have found, for example, many people that we were working with in those countries in Latin America are no longer working for the government anymore. Then it's complicated to continue this effort when you have to start again with different people. Of course, resources are always a little bit complicated, because it takes a little bit of resources to do this, to use this toolkit. And sometimes it's just a question of coordinations and to be able to really continue this intersectoral work and to make it work. For me, using this toolkit has a lot of opportunities. The main one is this opportunity of the intersectoral work, that is always very interesting to see how people start to connect between themselves and to see the strength of working together with the different ministries, with the different perspectives, and getting to know exactly how the Ministry of Energy is looking at the problem and understand it from the health perspective, from the environment perspective. It's always very useful. And for us from the health sector, it's very important to include the health sector in all this decision making, and the opportunity to do this collective reflection and to produce a report that can be shared and can be a basis for the work that the country is gonna make. And in particular, I think that is a very interesting learning process that I feel like it stays in the country and can contribute to develop this roadmap that then we can use to continue the work that you are going to do in a given country. Then I really recommend to use it, this toolkit. It's been really interesting for me, and well, this is it for me. Thank you, and I pass it to Julie. Thank you very much.
Thank you so much, Karin and Juan. I have to say, this is really fascinating for me. I feel like we so often hear of new tools and resources that are developed, but we don't hear so much about how they're actually used in practice. So super interesting. Great to hear that you were able to engage across ministries and generate interest there. So super interesting. Thank you again to you both. So let's hear from another example. We're going to switch geographies here and switch over to looking at an example from India. So I'll now invite Bhargav Krishna, who's adjunct faculty at the Public Health Foundation of India, to tell us about how he has used the heart templates and his experience. Bhargav, over to you.
Thank you so much, Julie. A pleasure to be here with all of you today. So I'm here to speak about our experience in implementing the heart tool in India. Next slide, please. So in our work, we had two partners, of course, myself and my colleagues from the Public Health Foundation of India, who carried out the work on the health side, and a small team from the Energy and Resources Institute, also based in Delhi, which carried out work on the energy side. For our work, we chose two states. Given the size of India, we thought it would be useful to narrow down on two states which have similar poverty levels, similar access to cooking issues, and slightly different demographics, to try and understand how to implement the tool best. As described earlier, we conducted the secondary data review using the toolkits provided in the heart tool. In addition to that, we also conducted over 40 interviews with officials from central and state governments, think tanks and NGOs in different parts of the country, to help triangulate the information that we collected using the tools that were provided as part of the toolkit. Next slide, please. So in the two states that we reviewed, we looked at the energy access and the health aspects of all of the work that's being done there. So for instance, in Rajasthan, there was 77% of rural households that were electrified, whereas almost all rural households were electrified in Maharashtra. They had similar poverty levels across both states, but there was a stark difference in the number of households that reported relying on solid fuels primarily for cooking. And this was an interesting aspect that we wanted to dig deeper on in our analysis. Next slide, please. The use of these solid fuels extensively also reflects in evidence that has been collected both on the exposure as well as in the health side. So in India has some of the highest exposures from cook stoves across different parts of the country. So for instance, the Indo-Gangetic Plain has some of the highest concentrations and some of the highest levels of continued use of solid fuels for cooking. The states that we've chosen, Rajasthan and Maharashtra, have slightly different levels of exposures and slightly different health outcomes as well. Overall, across the country, almost 900,000 people die every year as a result of exposure to household PM2.5. And the rates of health outcomes vary between the two states that we've chosen. So Rajasthan has a much higher burden than Maharashtra. Next slide, please. So the current scenario vis-a-vis health also, in addition to the pure numbers from the burden of disease, as well as the exposure numbers from interviews, we recognize that environmental health is only recently come into the picture from the perspective of the Ministry of Health, and isn't necessarily accorded the same kind of importance as, say, vertical disease programs are. Health is a side consideration really in policy formulation, and the health sector is really not involved in the formulation and implementation of these policies. A good example for something like this that isn't related to clean cooking would be the National Ambient Air Quality Standards, where engineers and atmospheric scientists are involved in the decision making, but the health sector really has no representation. On the household energy issue, currently there are several programs that are deployed by the government of India to address this issue, but they really lack this health frame and convergence across different ministries. And the Ministry of Health, aside from briefly touching on COPD as a disease within the National NCD program, does not really address household energy and its related health burden in any systematic way. Next slide, please. So from the 40 plus interviewees that we spoke with, we identified a series of challenges and we put them into 4 buckets. And so for the purposes of this presentation, I'll be focusing on 2 of them, which are health sector engagement and the issue of convergence and multisectorality of our challenge. Next slide, please. So on health sector engagement, the issue that we had was that there are still gaps in the evidence, even though a lot of new work has been published. And the lack of localized evidence is seen by health professionals as an issue. There is also a severe lack of awareness amongst health professionals. As we're sitting here on Earth Day, we can say clearly, and there was a recent study published by the Clean Air Fund as well, which spoke about how medical education needs to highlight environmental exposures more and more. In India, there is really no way by which environmental exposures are even covered in the medical education portfolio. This leads to a lack of awareness of this even being an issue amongst health professionals. The federal nature of the government and programs that are implemented both simultaneously by state and central governments mean that the accountability framework for implementation, at least in the health sector, is really unclear. And the paucity of human resources, the reliance heavily over and over again on the frontline health workers or ASHAs to implement new programs mean that there is really a lack of capacity in the health system and within those frontline health workers to deliver all of the kinds of programs that we would want to address issues like household air pollution. Next slide, please. On the issue of convergence and multisectorality, we noted in a lot of our research that multisectorality is often emphasized on paper, but never really put into practice. This issue of the lack of the health frame in policy making came up over and over again. It's not really considered a risk factor. So for instance, central government committees on air pollution generally do not even include the Ministry of Health and Family Welfare as a stakeholder, even though the burden of treating the illnesses arising from these diseases are put on the Ministry of Health and the health system themselves. And there are, of course, there's severe duplication of programs and missions in the past. This report is a little dated, it was completed a little while ago, but the broad issues still remain. Next slide, please. So as part of our work for the HART report, we conducted a review of the various institutions and ministries that are working within the household energy and health space. And we ended up with this chart, which kind of laid out all of the various linked and interlinked programs that are addressing the issue of household energy and health in India. And as you can see, there are numerous schemes within there. Only one of which is the Pradhan Mantri Ujjwala Yojana, which was the LPG scheme that was launched a few years ago now. And really the plurality of programs here don't really speak to each other. And that was a challenge that we thought we needed to address as we go towards the recommendations of this report, because there's a tremendous amount of funding. There's a tremendous amount of energy that's put into the development of all of these various programs that could be better channeled if there is convergence within various ministries. Next slide, please. So on our recommendations, we again put them into 4 buckets, but I'll focus on 2 aspects, which are convening and coordination and policy design and advocacy. Next slide, please. On convening and coordination, to address this issue of ministries working at cross purposes or duplicating each other's work or trying to address the same issues in slightly different ways, we suggested in our report that there should be put in place a standing committee on air pollution with a suggested framework as we've laid out on this slide. Which would be led by a joint group of Ministry of Environment and Ministry of Health officials with membership from various other relevant departments that would not only generate new evidence and develop new policies and evaluate existing programs, but also engage with various other stakeholders, including academia, as well as national and multilateral organizations that are interested in this kind of work. Because this would essentially try to bring together the best available evidence, implement that in terms of programs, and try and evaluate those programs so that there is continuous learning and evaluation of all the work. Next slide, please. On policy design and advocacy, what we found in our review was that while subsidies are available within the system, especially for programs such as the Ujjwala Yojana, they need to be more effective and better targeted by broadening the beneficiary pool, as well as addressing issues within the population who are just above the poverty line, who may not receive these subsidies, but still suffer the same kinds of exposures that others would who are living below the poverty line. The team from TERI identified that there needed to be innovative service delivery mechanisms, especially because some of these programs, such as the Ujjwala Yojana, would struggle to reach residents in very rural or remote areas. Distributors may not want to set up a facility to be able to distribute LPG cylinders to residents living in these areas, and we needed to try different ways to reach these populations. And tied to that would also be the aspect of promoting locally and culturally relevant customized solutions. So perhaps in a rural area, if it's not financially feasible for a distributor to set up an LPG distributorship, perhaps think about other ways that we could reach them and ensure that they are provided cleaner cooking solutions, perhaps using biogas or electricity or some other kind of means. And of course, the high upfront costs for some of these programs mean that we need to come up with more innovative consumer financing models, perhaps a pay-as-you-go model that would cover the cost of utilization or cover the upfront costs of whatever solution is being provided over a longer period of time. Next slide, please. So reflecting on the use of the tool, I think we learned as practitioners a fair amount in utilizing this tool, because we identified several programs that we didn't even know existed as part of the work. I think this was a big revelation for a lot of us working in this space. I think it was very effective at laying out the state of play in India vis-a-vis energy and health, and identifying new areas where we could tackle this issue more creatively. What we found, of course, is that the health rationale for these transitions to clean cooking are not nearly emphasized enough. This is true even with the Ujjwala Yojana, where the real rationale for the setup of that program initially, as articulated by people who've been working in this space, has been the rationale of health improvements associated with this transition. But the lack of awareness being spread about this potential health benefit is perhaps due to sort of a lack of knowledge amongst people working within the bureaucracy or within ministries as well. Siloed work, independent work across government departments proved to be highly detrimental in achieving reductions in exposure and increased exclusive use of clean fuels. I think there is great scope for different ministries such as the Ministry of Health, Ministry of Rural Development, and Ministry of Petroleum to work together to try and achieve similar goals that they've set out for each other and for themselves. And of course, I think seeing the plurality of programs that are available and the speed and the scale at which a program like the Ujjwala Yojana was expanded, I think we can safely say that financing is really not an issue, but targeting that funding effectively is. If we're duplicating programs, if we're adding unnecessary layers to the work that we're doing, it's not going to be as efficient as we would like it to be. And lastly, as we've seen, as the greatest challenge that we see going forward is the issue of sustained use of clean fuels. We are getting reports over the last 6 months or so that many people are going back to using wood or other solid biomass products, foregoing their LPG connections or LPG cylinders that they would otherwise be using. And so because this data isn't really being collected in any systematic way, we're relying on surveys to try and get this information so that we can develop this program. But any new program that is launched should centralize the issue of monitoring, learning, and evaluation, so that we learn and improve from our previous experiences and we achieve long-term goals more systematically. Last slide, please. So just as I conclude, I'll just introduce the teams. These are the individuals that worked on this report from TERI and PHFI, and we had a distinguished panel of advisors working with us as well as we developed this report, what is now a couple of years ago. Thank you so much.
Wonderful. Thank you so much, Bhargav. Super interesting findings. Again, I think it's so helpful to hear about how these tools have actually been used in practice and sort of what those outcomes have been. So really, really interesting. We are, of course, tight on time, so I'm going to keep things moving. So we've heard from some practitioners who have actually gone through and implemented the tool. And I'm really excited that we'll also hear from some policymakers who have been engaged in the use of the tool and hear about their experiences and sort of how it's helped them to think about planning and program design for clean cooking. So I will now hand things over to our first speaker in this section, which is Paul Mbuti, who's the Deputy Director of Renewable Energy for the Ministry of Energy of Kenya. Paul, over to you for some brief remarks.
Thank you very much, Julie. And I also thank the organizers for inviting me to make or share some perspectives on how the tools that have been used in other studies have helped to influence policymaking And at the onset, I need to upload, of course, the WHO and the Clean Cooking Alliance for the work they've done in the space of clean cooking. We really appreciate, we get a lot of information from the work that has been done by these institutions. But let me also first say that achieving sustainable cooking is one of the greatest challenges of our time. And the challenge of household air pollution, which is coming from the use of solid biomass fuels, is also one of the greatest environmental health risks of our time. And so this is a time when everyone needs to pay special attention and focus to address clean cooking, and particularly now speaking about the transition from clean cooking, I mean from the use of solid biomass fuels to clean cooking options. So it is on this basis that we observe that Kenya, for the last over 3 decades, has been promoting and looking into the space of clean cooking, only focused on the improved cook stoves. And I think time has come, because now we know that these devices are transitional devices. We really need to move the citizens to cleaner options because of the health burdens that are associated with the use of these solid fuels, even when we are using the improved biomass stoves. Now, the HAT tool that has been used or developed by WHO has been applied to the Kenyan situation, and a report has been prepared. It helped to really bring out insights in terms of what is the situation like, what is the access gap that is existing, who are the stakeholders who need to take action. And I think this has been very useful to enable the government decide on policy issues that relate to clean cooking. And this indeed has brought out very clear local evidence of the prevailing situations, and has highlighted the extent of the access gap. And this has been very useful, not only this study, but also all the studies that have been done. I want to also to state that during the time when this study, which applied the HAT tool, was being done, we were at the same time working out a review of the policy. And so we have a policy, a national energy policy of 2018, and which afterwards we have been able to craft a bioenergy strategy. Particularly the bioenergy strategy has been assisted by the insights that are coming from these different types of reports, including what has been done under the tool that we are speaking about. So in a nutshell, I'm trying to say that really where we are and at the time we are, the world needs, as a matter of urgency, to adopt very bold intervention strategies, because what we are seeing is the business as usual scenario is not likely to enable the world achieve the SDG 7 aspirations. And also the same applies to the national aspirations. Kenya has a Vision 2030, which among other things aspires to provide clean energy access. And this will be very useful if the world can get into a process of adopting and implementing very bold interventions. I need also to point out that many of these cooking solutions are going or cutting across many ministries, and hence the need for coordination. That is why we think that clean cooking is not a domain of the Ministry of Energy. It cuts across the Ministry of Health, the Ministry of Environment, the Ministry of Forestry, and all these in different countries. And that means if we are going to make workable strategies and policies, this must entail the coordination and participation of all the necessary stakeholders. Now, I need also to indicate, because of the same reasons, clean cooking or the cooking itself is a complex issue, and yet it affects everyone, regardless of which sector they belong, because all of us have to cook. And for that reason, we are stakeholders, because we need to be asking ourselves, what are the cook stoves or what are the cooking solutions and fuels that we are using? Now, important to note is as the policies and strategies are being developed, we notice that some of these solutions are very context specific. So you find not one solution fits everyone, but we need to adopt solutions to the local circumstances, including the cultural preferences, which we must address, because the study actually identified some of the key constraints to include the cultural perspectives, the attitudes, and what people decide is the attribute of the fuel they choose to cook with. And that is something that is important. So increasingly, there is need for mindset change that will really address the behavioral aspects of cooking so that we are able to access that clean cooking. I'm just to the last point now. And I'm saying that the opportunities to scale up access to clean cooking requires multi-agency, multi-sectoral involvement, including what international organizations are doing and what national institutions are doing, because as I earlier said, cooking impacts on everyone, but we need to ensure that people can access clean cooking so that we also reduce the associated burden, particularly for sub-Saharan Africa, where solid biomass fuels are being used in a big way. And so for us, we want to appreciate this opportunity and say we want to be part of the solutions. We want to contribute to the process of what HEPA is trying to achieve. And we'll be happy that to see a world where sustainable access to clean cooking has been attained. Over to you, and thank you for listening to me.
Thank you so much, Paul. Really inspiring. I really appreciated your emphasis on boldness and how we all have to be bold in this sector. We are getting short on time, so I'm going to keep things moving. And just a quick reminder before we go to the next speaker, if you do have questions before we get to the Q&A session, which may be a little shorter than we planned, but please remember to submit those through the Q&A function. And again, we'll try and get to as many as we can. So we're going to move back over to Latin America and hear some brief, actually some video remarks from Fanny Castillo, who's the technical officer for the Department of Environmental Health, Ministry of Health, Panama. And she was a little concerned about connection issues, so she was kind enough to record a video for us.
The Home Access Rapid Assessment Tool, HART, this tool will allow us to see an overview in the collection of information of energy use in homes and its impact on public health. The Behave project was carried out in Panama. Air pollution in homes is related to 3 of the main causes of disease in Panama: heart disease, stroke, and acute and chronic respiratory disease. Type of disease related to the use of firewood, where more than 1,000 deaths are evidenced in the province of Panama, and approximately 2,400 deaths in the province of Chiriquí during the year 2016. The main fuel used for cooking in Panama is LPG, followed by firewood, and to a lesser extent electricity. The reason that the province uses more is liquid gas. The subsidy offered by the country for the concession of this fuel. It is important to highlight that in the indigenous regions, energy is used for lighting, where kerosene fuel is used the most.
Many thanks again, Fanny, for recording it, and sorry about the technical issues. But again, we'll make that available so that folks can hear it later. So why don't we move to Dr. Abraham Ortinez, who is a technical expert for the National Institute of Ecology and Climate Change of Mexico. And he will give us his perspectives on how the HEART tool has been used in Mexico. So Abraham, over to you.
Thank you, Julie. Thank you to everyone. Thank you for the invitation. Well, I just want to talk about the Mexican background, and probably with a document was shown by the Dr. Karin Troncoso regarding of the situation of Mexico. For Mexico, it's very important, the residential sector. Mainly, it's divided into two important subsectors, there's the urban and rural. The contribution of the rural in Mexico in terms of the emissions, for example, during the 2015 National Emission Inventory, shows that the black carbon emissions are mainly the main important emissions coming from the burning of solid fuels in this sector. And it's very important because it's the burning of biomass in homes, specifically in poorest areas. With the participation in this process with the HEART tool, we identified the most important states in Mexico that we can improve and help them to change or make this transition to other kind of technologies. For example, in Mexico's Chiapas, Veracruz, Oaxaca, and Guerrero. And it's very important, these states, because it's the poorest states in Mexico. So, as well, in the residential sector, we have 30 gigagrams of black carbon emitted. We're talking about today about the now the process we are currently is happening in regarding of the climate change issues. So Mexico was mentioned as well by Dr. Troncoso, is committed to mitigate the black carbon. So we identified that this is the second sector in Mexico that it's relevant in terms of emissions of black carbon. The analysis that we carry out with the PAHO through the HEART process show that around 18 million of people in Mexico depend on biomass burning to cooking and heat water. And it's very important challenge because this, as I mentioned, it's coming from greater poverty areas with difficult access to alternative fuels, such, for example, in case of Mexico, gas LP and natural gas, or even electricity. The main problems with biomass burning is increasing currently, even in the COVID, because, well, we know everyone that the situation in terms of the economical crisis is very relevant now. When we did these scenarios, we find that the problem is that the consumption in these states, it's related to the poverty. So what will be happen now with this COVID situation? Probably will increase more the consumption of biomass burning because the people we could not access in terms of economical problems, we could not access to other kind of fuels. So will increase the particle matter, the black carbon, and other pollutants. In microenvironments, is related to increase the case of respiratory diseases, was mentioned as well by other colleagues, and associate with other health issues. The energy consumptions per household are associated with other variables we find with this analysis with the HEART tool, is the incomes and as well the situation where the people is living. So this tool can help us to identify what is the next actions that we need to take in account for the policies. Other thing we did with this analysis with the HART tool is the proposal of mitigation scenarios. I share with you in the chat the link to one of the documents that we developed with the PAHO, with the Pan American Health Organization, with Karin Troncoso as well, one of our main participants, is to develop the integrated strategies in short-lived climate pollutants and to improve the air quality and reduce the impact of climate change. You can take a look. Unfortunately, it's only in Spanish, but it's can be translated to English or even to other languages. So we create a proposal of mitigation scenarios, and you can find there. One of the things is the reduction of biomass due to cook stock or improved cook stocks. Other thing is we put in the table is the switch to consumption of fossil clean fuels. And when I put the fossil clean fuels, because we could not say that it's clean, but it's in terms of help probably reduce the impacts, but in terms of climate change commitments or in terms of air quality, probably is not the best one. So we need to think more about that. And the other point we put in the table as well is to use the electricity as part of the cooking process or even for heating. That is the things we need to take a look, because in terms of Mexico, we have a challenge in our electricity system. So, but we think that it's feasible to do this kind of technologies to put in cooking and heating. Well, Mexico has been participating in developing the HART tool, and we are committed to working with PAHO, with the World Organization Health, and other actors to promote the tool that can help us to promote the transition to zero emissions in terms of cooking and heating, and try to go to clean energies, to healthy energies, we can say that, and include all these actions and recommendations in the document, as I mentioned to you, and I share with you in the chat. Thank you very much, and thank you for the invitation.
Great, thank you so much, Abraham, and really great to hear Mexico's commitment to clean cooking, and that you had a really good experience using the HART tool. We are a little bit short on time, but we're gonna go through a few questions, and then we'll also leave the webinar open for about 10 minutes after our planned end time, in case folks want to stay on and go through some additional questions. So I'm going to start with a question for Jess, which came through about whether there are any plans to do additional assessments in other countries, and maybe related to that, is there any support available for countries who are interested in implementing the HART templates?
Wonderful, thank you very much. Yes, we have received a number of questions about specific countries which are wondering about work there. And other than the countries that I mentioned on the slide, we are not currently aware of any HART reports underway in other countries, but we encourage countries and participants that are interested in using these tools for situational assessment and stakeholder mapping to please use them. This can be done by any or all stakeholders, for example, universities, ministries that would like to undertake a project looking at these opportunities for transition for clean household energy. And some of the steps that we would suggest for initiating a new project would be to first identify a lead organization, which could either be an NGO or a ministry or a university or others, and then to identify a specific focal point within that organization that could lead in completion of the template. And we've had many countries where there is an external consultant hired, so it need not necessarily be someone within the ministry, although of course you've heard today from some examples where ministries were very closely involved in completing the templates and the report. And finally, you are welcome to contact WHO for support using the email address that we have in the chat window for any further questions. Thanks.
Great, thank you so much, Jess. Another question that's come through is around the role of local communities, so the actual users of cooking fuels and technologies in using the heart templates, and sort of how that perspective is integrated, or if it is, I guess. So I don't know if perhaps Karen or Juan have any anything to share there.
Well, yes. Of course, the hard toolkit is done like more as at a high level, political level, and we usually collect data from different ministries and different sources. But one way of getting people's experience into account is through a literature review that we do. And then what we do is to look at the different studies that have been produced in a given country, and then look at what are the cooking practices, the specific situation of population living on that particular country. And that's the only way we have really using the toolkit to consider people's perspectives.
Got it. Thank you, Karen. All right, next question. This is a really hard one. So we heard throughout that the use of the tool did facilitate engagement across ministries and did sort of generate interest from ministries of health, but also heard particularly from Bargov that there's still a lack of awareness amongst health sector professionals on household air pollution and the health impacts of non-clean cooking. So the question is, how do we change that? How do we increase that awareness? How do we increase the motivation of the health sector to engage on this issue? So Bargov, I'll direct that to you.
Thank you, Julie. An interesting point related to this was, I don't know if anybody's read the recent report from the UK on the coroner's report on the ADVOCACY death. And one of the recommendations of that report has been that education around air pollution and other environmental risk factors need to be mainstreamed in medical education. This was a recommendation that was made by a steering committee in India as well of the Ministry of Health on air pollution, noting clearly that it's not a part of medical education anywhere, and it's not considered a proximal risk factor for health. And I think going back to the sort of source of how health professionals are trained is sort of key to this aspect. Perhaps in-service training for existing health professionals would also be a useful means by which we could expand knowledge around air pollution and its impact on individuals within the medical community.
Indeed, makes sense. Juan, would you like to add to that?
Yes, absolutely. And thank you, Julie. And I think that is a great question, and one that we are trying to respond every time that we approach to this topic. Adding to the component of including education on air pollution, also we think that it's important to try to do like a multi-stakeholder engagement between the health sector, saying that, so like we are trying to connect with non-communicable diseases, healthy environments, physical activity. So this issue is not addressed just by the environmental health department, but that we are able to make the connection with other areas of the health sector, and that help us to gain momentum to advance on these policies. And also something that has been very useful for us is to see what is the burden of disease attributable to specifically household air pollution, that help us to raise awareness, putting like the numbers to this situation that help us to mobilize action on this regard. Over.
Great, thank you, Juan. All right, let's go to another question. So looks like folks are interested in hearing a bit more on how the HART report has helped to influence policymaking and sort of how that was used in adapting to the country context. So perhaps I'll invite Fanny, if her audio is working, to respond there. If she could talk a little bit more about how the HEART tool has been used in Panama. Okay, she may be having trouble.
Yeah, I think, yeah, she's having issues with
Maybe we need to translate.
I think
Fanny,
she's concerned about her audio. I just wanted to give her an opportunity to speak, just especially because we missed her video. But
Yes, yes.
Fanny, si quieres,
¿Me
¿te
escuchan
podemos
bien?
traducir?
Ah, sí, te lo agradecería porque tengo muy mal pronunciación.
Sí, entonces puedes decir la experiencia del sector de la Secretaría de Salud en Panamá.
Bueno, sí, en estos momentos estamos trabajando en la adopción de las recomendaciones de calidad de aire interior y ya todo el paquete está en asesoría legal.
She says that at this moment they are working in Panama with the recommendations that the HEART report made and trying to make them possible through their legal department.
great, thank you. And thank you, Karen, for translating. Okay, maybe Paul or Abraham, did you want to add anything to that question? Anything further to elaborate on sort of how you use the HEART tool in practice?
Thank you. Let me put a comment on the same. As was pointed out earlier, the tool provided a high-level approach and assessment of some of the high-level issues, and that was important in pointing to the higher level of the issues. But we were able still to get to bring the institutions together. We have an interagency ministerial committee on clean cooking, and where these matters were being shared. And then at the second level of government in the counties, we also were able to discuss this in technical working groups, which are formed in the counties to work between the national government and the county governments. And this was the way that enabled continuous awareness. But I need to end by saying that awareness, capacity building, and the public education are continuous activities which we must keep undertaking, because then as long as there is an access gap, we need to be speaking to people to enlighten them on matters of the choices they are making for their clean cooking solutions. So it broadly pointed to these big issues, but we then began to move down the line to the lower income levels so that we can communicate necessary information to facilitate decisions into the choices of fuels and technologies. Thank you.
Thank you for that, Paul.
Yes, just a little comment. It's in terms of the HEART helped us to bring onto the institutions together and to create awareness of the problem in terms of health, environmental, energy, and also facilitated the conversation with other actors like academics and organizations, for example. This is the way that we can use the HEART tool.
Great, thank you. Glad to hear that that is how it can be used effectively. Okay, well, we are over time, so I'm going to go ahead and wrap things up. Before we close, I'd like to invite Heather Adair Rohani, who is the team leader on energy and health at the WHO, to provide us with some brief closing remarks.
Hello everyone. As mentioned, my name is Heather Adair Rohani, and Yes, I lead the work at WHO on health and energy. And I really want to just say thank you all for your participation. Thank you to all the panelists. We heard some great introductory remarks from Dymphna and Dr. Neira on HEPA, as well as just laying out the landscape and the important work going on around energy and the political rising of the issue with the climate and the high-level dialogue of energy coming up. We heard some great words from Sheila about the high-level coalition, as well as Jess and Juan about the heart tool and its use in various regions, and Karine, her experiences working in Latin American countries, working with the heart, and really seeing how, for example, in Panama, they saw one of the barriers and where the LPG was not necessarily, the subsidies weren't getting to the right place, so they were able to adjust their policy. We heard some interesting experiences from Bargov and basically mapping about programs they didn't even know existed within their country. So it was great connecting those actors. We heard about Paul, how they're able to really identify the high level, the certain strategies, and really connecting the health argument and these technologies. So this was very important. As well, from we've heard from Abraham and Fanny as well, also of how, you know, in Mexico it was used particularly in relation to black carbon and how this is becoming an important issue. And we will hear from the video from Fanny later on. So I really think this is a very important discussion, fruitful, really showed us how we can really need to sometimes take a step back and look at where all these actors are working together. What is the situation in a country? And then understanding those barriers to really help design and implement policy, or even adapt policies to better make sure that we can really facilitate this transition to clean household energy to protect health. So I really appreciate all the time and interesting questions and interest as well. And as noted by Jess and others, the heart tool is available online, and we're available for more questions and follow-up if you send us an email at the email address listed. Thank you all, and wishing you all a pleasant day, evening, or morning. Thank you.
Many thanks, Heather, for that wonderful wrap up. And just wanted to extend another round of thanks to all of our speakers today, as well as the participants for joining us. As we mentioned at the top of the webinar, this is part of a series, the Transitioning to Clean Cooking webinar series. So we'll be conducting some additional webinars throughout the year. These dates are tentative, so don't hold us to them, but these are some of the topics that we have in mind. So we'll be looking at the latest data, at cost-benefit analyses that have been done around clean cooking, looking at the various fuels and technologies that are out there, looking at building capacity for the adoption and adaptation of cook stove standards, and then also looking at the intersection of clean cooking and climate change. So we hope you will join us for the subsequent webinars. There is a sign up on the website for the webinar series where you can indicate your interest in joining these, and you'll get the invitations. So with that, I think we'll close. Again, many thanks to all who have joined, and wishing you all a good day. Thank you so much.